1910.1025, Appendix B Employee Standard Summary. Appendix B to Section 1910.1025 Employee Standard Summary. This appendix summarizes key provisions of the standard that you as a worker should become familiar with. A permissible exposure limit, PEL, paragraph C. The standards sets a permissible exposure limit, PL, of 50 micrograms of lead per cubic meter of air, 50 micrograms per cubic meter, averaged over an 8-hour workday. This is the highest level of lead in air to which you may be permissibly exposed over an 8-hour workday. Since it is an 8-hour average, it permits short exposures above the PL so long as for each 8-hour workday your average exposure does not exceed the PL. This standard recognizes that your daily exposure to lead can extend beyond a typical 8-hour workday as the result of overtime or other alterations in your work schedule. To deal with this, the standard contains a formula which reduces your permissible exposure when you are exposed more than 8 hours. For example, if you are exposed to lead for 10 hours a day, the maximum permitted average exposure would be 40 micrograms per cubic meter. 2. Exposure monitoring, paragraph D. F. Lead is present in the workplace where you work in any quantity. Your employer is required to make an initial determination of whether the action level is exceeded for any employee. This initial determination must include instrument monitoring of the air for the presence of lead and must cover the exposure of a representative number of employees who are reasonably believed to have the highest exposure levels. If your employer has conducted appropriate air sampling for lead in the past year, he may use these results. If there have been any employee complaints of symptoms which may be attributable to exposure to lead, or if there is any other information or observations which would indicate employee exposure to lead, this must also be considered as part of the initial determination. This initial determination must have been completed by March 31, 1979. If this initial determination shows that a reasonable possibility exists that any employee may be exposed, without regard to respirators, over the action level, 30 micrograms per cubic meter, your employer must set up an air monitoring program to determine the exposure level of every employee exposed to lead at your workplace. In carrying out this air monitoring program, your employer is not required to monitor the exposure of every employee, but he must monitor a representative number of employees and job types. Enough sampling must be done to enable each employee's exposure level to be reasonably at least one full shift, at least 7 hours, air sample. In addition, these air samples must be taken under conditions which represent each employee's regular, daily exposure to lead. All initial exposure monitoring must have been completed by May 30, 1979. If you are exposed to lead and air sampling is performed, your employer is required to quickly notify you in writing of air monitoring results which represent your exposure. If the results indicate your exposure exceeds the PL, without regard to your use of respirators, then your employer must also notify you of this in writing, and provide you with a description of the corrective action that will be taken to reduce your exposure. Your exposure must be rechecked by monitoring every 6 months if your exposure is over the action level but below the PL. Air monitoring must be repeated every 3 months if you are exposed over the PL. Your employer may discontinue monitoring for you if 2 consecutive measurements, taken at least 2 weeks apart, are below the action level. However, whenever there is a production, process, control, or personnel change at your workplace which may result in new or additional exposure to lead, or whenever there is any other reason to suspect a change which may result in new or additional exposure to lead, your employer must perform additional monitoring. 3. Methods of compliance, paragraph E. Your employer is required to assure that no employee is exposed to lead in excess of the PL. The standard establishes a priority of methods to be used to meet the PEL. 4. Respiratory protection, paragraph F. Your employer is required to provide and assure your use of respirators when your exposure to lead is not controlled below the PL by other means. The employer must pay the cost of the respirator. Whenever you request one, your employer is also required to provide you a respirator even if your air exposure level does not exceed the PL. You might desire a respirator when, for example, you have received medical advice that your lead absorption should be decreased. Or, you may intend to have children in the near future, and want to reduce the level of lead in your body to minimize adverse reproductive effects. While respirators are the least satisfactory means of controlling your exposure, they are capable of providing significant protection if properly chosen, fitted, worn, cleaned, maintained, and replaced when they stop providing adequate protection. Your employer is required to select respirators from the 7 types listed in Table 2 of the Respiratory Protection section of the Standard, Section 1910.1025, F. Any respirator chosen must be approved by the National Institute for Occupational Safety and Health, NIOSH, under the provisions of 42 CFR Part 84. This respirator selection table will enable your employer to choose a type of respirator that will give you a proper amount of protection based on your airborne lead exposure. Your employer may select a type of respirator that provides greater protection than that required by the standard, that is, one recommended for a higher concentration of lead than is present in your workplace. For example, a powered air purifying respirator, PAPR, is much more protective than a typical negative pressure respirator, and may also be more comfortable to wear. A PAPR has a filter, cartridge, or canister to clean the air, and a power source that continuously blows filtered air into your breathing zone. Your employer might make a PAPR available to you to ease the burden of having to wear a respirator for long periods of time. The standard provides that you can obtain a PAPR upon request. Your employer must also start a respiratory protection program. This program must include written procedures for the proper selection, use, cleaning, storage, and maintenance of respirators. Your employer must ensure that your respirator facepiece fits properly. Proper fit of a respirator facepiece is critical to your protection from airborne lead. Obtaining a proper fit on each employee may require your employer to make available several different types of respirator masks. To ensure that your respirator fits properly and that facepiece leakage is minimal, your employer must give you either a qualitative or quantitative fit test as specified in Appendix A of the Respiratory Protection Standard located at 29 CFR 1910.134. You must also receive from your employer proper training in the use of respirators. Your employer is required to teach you how to wear a respirator, to know why it is needed, and to understand its limitations. The standard provides that if your respirator uses filter elements, you must be given an opportunity to change the filter elements whenever an increase in breathing resistance is detected. You also must be permitted to periodically leave your work area to wash your face and respirator facepiece whenever necessary to prevent skin irritation. If you ever have difficulty in breathing during a fit test or while using a respirator, your employer must make a medical examination available to you to determine whether you can safely wear a respirator. The result of this examination may be to give you a positive pressure respirator, which reduces breathing resistance, or to provide alternative means of protection. V. Protective work clothing and equipment. Paragraph G. If you are exposed to lead above the PL, or if you are exposed to lead compounds such as lead arsenate or lead azide which can cause skin and eye irritation, your employer must provide you with protective work clothing and equipment appropriate for the hazard. If work clothing is provided, it must be provided in a clean and dry condition at least weekly, and daily if your airborne exposure to lead is greater than 200 micrograms per cubic meter. Appropriate protective work clothing and equipment can include coveralls or similar full-body work clothing, gloves, hats, shoes or disposable shoe coverlets, and face shields or vented goggles. Your employer is required to provide all such equipment at no cost to you. He is responsible for providing repairs and replacement as necessary, and also is responsible for the cleaning, laundering or disposal of protective clothing and equipment. Contaminated work clothing or equipment must be removed in change rooms and not worn home where you will extend your exposure and expose your family, since lead from your clothing can accumulate in your house, car, etc. Contaminated clothing which is to be cleaned, laundered or disposed of must be placed in closed containers in the change room. At no time may lead be removed from protective clothing or equipment by any means which disperses lead into the workroom air. 6. Housekeeping. Paragraph H. Your employer must establish a housekeeping program sufficient to maintain all surfaces as free as practicable of accumulations of lead dust. Vacuuming is the preferred method of meeting this requirement, and the use of compressed air to clean floors and other surfaces is absolutely prohibited. Dry or wet sweeping, shoveling, or brushing may not be used except where vacuuming or other equally effective methods have been tried and do not work. Vacuums must be used and emptied in a manner which minimizes the re-entry of lead into the workplace. 7. Hygiene facilities and practices, paragraph I. The standard requires that change rooms, showers, and filtered air lunchrooms be constructed and made available to workers exposed to lead above the PL. When the PL is exceeded, the employer must assure that food and beverage is not present or consumed, tobacco products are not present or used, and cosmetics are not applied, except in these facilities. Change rooms, showers, and lunchrooms must be used by workers exposed in excess of the PL. After showering, no clothing or equipment worn during the shift may be worn home, and this includes shoes and underwear. Your own clothing worn during the shift should be carried home and cleaned carefully so that it does not contaminate your home. Lunchrooms may not be entered with protective clothing or equipment unless surface dust has been removed by vacuuming, downdraft booth, or other cleaning method. Finally, workers exposed above the PL must wash both their hands and faces prior to eating, drinking, smoking, or applying cosmetics. All of the facilities and hygiene practices just discussed are essential to minimize additional sources of lead absorption from inhalation or ingestion of lead that may accumulate on you, your clothes, or your possessions. Strict compliance with these provisions can virtually eliminate several sources of lead exposure which significantly contribute to excessive lead absorption. 8. Medical surveillance, paragraph J. The medical surveillance program is part of the standard's comprehensive approach to the prevention of lead-related disease. Its purpose is to supplement the main thrust of the standard, which is aimed at minimizing airborne concentrations of lead and sources of ingestion. Only medical surveillance can determine if the other provisions of the standard have effectively protected you as an individual. Compliance with the standard's provision will protect most workers from the adverse effects of lead exposure, but may not be satisfactory to protect individual workers: 1. Who have high body burdens of lead acquired over past years; 2. Who have additional uncontrolled sources of non-occupational lead exposure; 3. Who exhibit unusual variations in lead absorption rates; or 4. Who have specific non-work related medical conditions which could be aggravated by lead exposure, e.g., renal disease, anemia. In addition, control systems may fail, or hygiene and respirator programs may be inadequate. Periodic medical surveillance of individual workers will help detect those failures. Medical surveillance will also be important to protect your reproductive ability regardless of whether you are a man or woman. All medical surveillance required by the standard must be performed by or under the supervision of a licensed physician. The employer must provide required medical surveillance without cost to employees and at a reasonable time and place. The standard's medical surveillance program has two parts: periodic biological monitoring and medical examinations. Your employer's obligation to offer you medical surveillance is triggered by the results of the air monitoring program. Medical surveillance must be made available to all employees who are exposed in excess of the action level for more than 30 days a year. The initial phase of the medical surveillance program, which includes blood lead level tests and medical examinations, must be completed for all covered employees no later than August 28, 1979. Priority within this first round of medical surveillance must be given to employees whom the employer believes to be at greatest risk from continued exposure, for example, those with the longest prior exposure to lead, or those with the highest current exposure. Thereafter, the employer must periodically make medical surveillance, both biological monitoring and medical examinations, available to all covered employees. Biological monitoring under the standard consists of blood lead level, PBB, and zinc protoporphyrin tests at least every 6 months after the initial PBB test. A zinc protoporphyrin, ZPP, test is a very useful blood test which measures an effect of lead on your body. Thus, biological monitoring under the standard is currently limited to PBB testing. If a worker's PBB exceeds 40 G/100 G, the monitoring frequency must be increased from every 6 months to at least every 2 months and not reduced until 2 consecutive PBBs indicate a blood lead level below 40 G/100 G. Each time your PBB is determined to be over 40 G/100 G, your employer must notify you of this in writing within 5 working days of his receipt of the test results. The employer must also inform you that the standard requires temporary medical removal with economic protection when your PBB exceeds certain criteria. See discussion of medical removal protection, paragraph K. During the first year of the standard, this removal criterion is 80 G/100 G. Anytime your PBB exceeds 80G/100G, your employer must make available to you a prompt follow-up PBB test to ascertain your PBB. If the two tests both exceed 80G/100G and you are temporarily removed, then your employer must make successive PBB tests available to you on a monthly basis during the period of your removal. Medical examinations beyond the initial one must be made available on an annual basis if your blood lead level exceeds 40G/100G at any time during the preceding year. The initial examination will provide information to establish a baseline to which subsequent data can be compared. An initial medical examination must also be made available, prior to assignment, for each employee being assigned for the first time to an area where the airborne concentration of lead equals or exceeds the action level. In addition, a medical examination or consultation must be made available as soon as possible if you notify your employer that you are experiencing signs or symptoms commonly associated with lead poisoning or that you have difficulty breathing while wearing a respirator or during a respirator fit test. You must also be provided a medical examination or consultation if you notify your employer that you desire medical advice concerning the effects of current or past exposure to lead on your ability to procreate a healthy child. Finally, appropriate follow-up medical examinations or consultations may also be provided for employees who have been temporarily removed from exposure under the medical removal protection provisions of the standard. See Part 9, below. The standard specifies the minimum content of pre-assignment and annual medical examinations. The content of other types of medical examinations and consultations is left up to the sound discretion of the examining physician. Pre-assignment and annual medical examinations must include 1. A detailed work history and medical history, 2. A thorough physical examination, and 3. A series of laboratory tests designed to check your blood chemistry and your kidney function. In addition, at any time upon your request, a laboratory evaluation of male fertility will be made, microscopic examination of a sperm sample, or a pregnancy test will be given. The standard does not require that you participate in any of the medical procedures, tests, etc., which your employer is required to make available to you. Medical surveillance can, however, play a very important role in protecting your health. You are strongly encouraged, therefore, to participate in a meaningful fashion. The standard contains a multiple physician review mechanism which would give you a chance to have a physician of your choice directly participate in the medical surveillance program. If you were dissatisfied with an examination by a physician chosen by your employer, you could select a second physician to conduct an independent analysis. The two doctors would attempt to resolve any differences of opinion, and select a third physician to resolve any firm dispute. Generally, your employer will choose the physician who conducts medical surveillance under the lead standard unless you and your employer can agree on the choice of a physician or physicians. Some companies and unions have agreed in advance, for example, to use certain independent medical laboratories or panels of physicians. Any of these arrangements are acceptable so long as required medical surveillance is made available to workers. The standard requires your employer to provide certain information to a physician to aid in his or her examination of you. This information includes 1. The standard and its appendices, 2. A description of your duties as they relate to lead exposure, 3. Your exposure level, 4. A description of personal protective equipment you wear, 5. Prior blood lead level results, and 6. Prior written medical opinions concerning you that the employer has. After a medical examination or consultation, the physician must prepare a written report which must contain 1. The physician's opinion as to whether you have any medical condition which places you at increased risk of material impairment to health from exposure to lead, 2. Any recommended special protective measures to be provided to you, 3. Any blood lead level determinations, and 4. Any recommended limitation on your use of respirators. This last element must include a determination of whether you can wear a powered air purifying respirator, PAPR, if you are found unable to wear a negative pressure respirator. The medical surveillance program of the lead standard may at some point in time serve to notify certain workers that they have acquired a disease or other adverse medical condition as a result of occupational lead exposure. If this is true, these workers might have legal rights to compensation from public agencies, their employers, firms that supply hazardous products to their employers, or other persons. Some states have laws, including worker compensation laws, that disallow a worker who learns of a job-related health impairment to sue, unless the worker sues within a short period of time after learning of the impairment. This period of time may be a matter of months or years. An attorney can be consulted about these possibilities. It should be stressed that OSHA is in no way trying to either encourage or discourage claims or lawsuits. However, since results of the standard's medical surveillance program can significantly affect the legal remedies of a worker who has acquired a job-related disease or impairment, it is proper for OSHA to make you aware of this. The medical surveillance section of the standard also contains provisions dealing with chelation. Chelation is the use of certain drugs, administered in pill form or injected into the body, to reduce the amount of lead absorbed in body tissues. Experience accumulated by the medical and scientific communities has largely confirmed the effectiveness of this type of therapy for the treatment of very severe lead poisoning. On the other hand, it has also been established that there can be a long list of extremely harmful side effects associated with the use of chelating agents. The medical community has balanced the advantages and disadvantages resulting from the use of chelating agents in various circumstances and has established when the use of these agents is acceptable. The standard includes these accepted limitations due to a history of abuse of chelation therapy by some lead companies. The most widely used chelating agents are calcium disodium EDTA, Ca2 EDTA, calcium disodium versenate, and D-penicillamine, penicillamine or cupramine. The standard prohibits prophylactic chelation of any employee by any person the employer retains, supervises, or controls. Prophylactic chelation is the routine use of chelating or similarly acting drugs to prevent elevated blood levels in workers who are occupationally exposed to lead, or the use of these drugs to routinely lower blood lead levels to pre-designated concentrations believed to be safe. It should be emphasized that where an employer takes a worker who has no symptoms of lead poisoning and has chelation carried out by a physician, either inside or outside of a hospital, solely to reduce the worker's blood lead level, that will generally be considered prophylactic chelation. The use of a hospital and a physician does not mean that prophylactic chelation is not being performed. Routine chelation to prevent, increased or reduce current blood lead levels is unacceptable whatever the setting. The standard allows the use of therapeutic or diagnostic chelation if administered under the supervision of a licensed physician in a clinical setting with thorough and appropriate medical monitoring. Therapeutic chelation responds to severe lead poisoning where there are marked symptoms. Diagnostic chelation involved giving a patient a dose of the drug then collecting all urine excreted for some period of time as an aid to the diagnosis of lead poisoning. In cases where the examining physician determines that chelation is appropriate, you must be notified in writing of this fact before such treatment. This will inform you of a potentially harmful treatment and allow you to obtain a second opinion. 9. Medical Removal Protection Paragraph K. Excessive lead absorption subjects you to increased risk of disease. Medical removal protection, MRP, is a means of protecting you when, for whatever reasons, other methods, such as engineering controls, work practices, and respirators, have failed to provide the protection you need. MRP involves the temporary removal of a worker from his or her regular job to a place of significantly lower exposure without any loss of earnings, seniority, or other employment rights or benefits. The purpose of this program is to cease further lead absorption and allow your body to naturally excrete lead which has previously been absorbed. Temporary medical removal can result from an elevated blood lead level or a medical opinion. Up to 18 months of protection is provided as a result of either form of removal. The vast majority of removed workers, however, will return to their former jobs long before this 18-month period expires. The standard contains special provisions to deal with the extraordinary but possible case where a long-term worker's blood lead level does not adequately decline during 18 months of removal. During the first year of the standard, if your blood lead level is 80 G/100 G or above, you must be removed from any exposure where your air lead level without a respirator would be 100 micrograms per cubic meter or above. If you are removed from your normal job, you may not be returned until your blood lead level declines to at least 60 G/100 G. These criteria for removal and return will change according to the following schedule. This table contains the information on removal and return to work criteria. You may also be removed from exposure even if your blood lead levels are below these criteria if a final medical determination indicates that you temporarily need reduced lead exposure for medical reasons. If the physician who is implementing your employer's medical program makes a final written opinion recommending your removal or other special protective measures, your employer must implement the physician's recommendation. If you are removed in this manner, you may only be returned when the doctor indicates that it is safe for you to do so. The standard does not give specific instructions dealing with what an employer must do with a removed worker. Your job assignment upon removal is a matter for you, your employer, and your union, if any, to work out consistent with existing procedures for job assignments. Each removal must be accomplished in a manner consistent with existing collective bargaining relationships. Your employer is given broad discretion to implement temporary removals so long as no attempt is made to override existing agreements. Similarly, a removed worker is provided no right to veto an employer's choice which satisfies the standard. In most cases, employers will likely transfer removed employees to other jobs with sufficiently low lead exposure. Alternatively, a worker's hours may be reduced so that the time-weighted average exposure is reduced, or he or she may be temporarily laid off if no other alternative is feasible. In all of these situations, MRP benefits must be provided during the period of removal, i.e., you continue to receive the same earnings, seniority, and other rights and benefits you would have had if you had not been removed. Earnings includes more than just your base wage. It includes overtime, shift differentials, incentives, and other compensation you would have earned if you had not been removed. During the period of removal, you must also be provided with appropriate follow-up medical surveillance. If you were removed because your blood lead level was too high, you must be provided with a monthly blood test. If a medical opinion caused your removal, you must be provided medical tests or examinations that the doctor believes to be appropriate. If you do not participate in this follow-up medical surveillance, you may lose your eligibility for MRP benefits. When you are medically eligible to return to your former job, your employer must return you to your former job status. This means that you are entitled to the position, wages, benefits, etc. you would have had if you had not been removed. If you would still be in your old job if no removal had occurred, that is where you go back. If not, you are returned consistent with whatever job assignment discretion your employer would have had if no removal had occurred. MRP only seeks to maintain your rights, not expand them or diminish them. If you are removed under MRP and you are also eligible for worker compensation or other compensation for lost wages, your employer's MRP benefits obligation is reduced by the amount that you actually receive from these other sources. This is also true if you obtain other employment during the time you are laid off with MRP benefits. The standard also covers situations where an employer voluntarily removes a worker from exposure to lead due to the effects of lead on the employee's medical condition, even though the standard does not require removal. In these situations, MRP benefits must still be provided as though the standard required removal. Finally, it is important to note that in all cases where removal is required, respirators cannot be used as a substitute. Respirators may be used before removal becomes necessary, but not as an alternative to a transfer to a low-exposure job, or to a layoff with MRP benefits. X. Employee Information and Training, Paragraph L. Your employer is required to provide an information and training program for all employees exposed to lead above the action level or who may suffer skin or eye irritation from lead. This program must inform these employees of the specific hazards associated with their work environment, protective measures which can be taken, the danger of lead to their bodies, including their reproductive systems, and their rights under the standard. In addition, your employer must make readily available to all employees, including those exposed below the action level, a copy of the standard and its appendices, and must distribute to all employees any materials provided to the employer by the Occupational Safety and Health Administration, OSHA. Your employer is required to complete this training program for all employees by August 28, 1979. After this date, all new employees must be trained prior to initial assignment to areas where there is a possibility of exposure over the action level. This training program must also be provided at least annually thereafter. 11. Signs, Paragraph M. The standard requires that the following warning sign be posted in the work areas when the exposure to lead exceeds the PL. Danger. Lead. May damage fertility or the unborn child. Causes damage to the central nervous system. Do not eat, drink, or smoke in this area. However, prior to June 1, 2016, employers may use the following legend in lieu of that specified above. Warning. Lead work area. Poison. No smoking or eating. 12. Record keeping. Paragraph N. Your employer is required to keep all records of exposure monitoring for airborne lead. These records must include the name and job classification of employees measured, details of the sampling and analytic techniques, the results of this sampling, and the type of respiratory protection being worn by the person sampled. Your employer is also required to keep all records of biological monitoring and medical examination results. These must include the names of the employees, the physician's written opinion, and a copy of the results of the examination. All of the above kinds of records must be kept for 40 years, or for at least 20 years after your termination of employment, whichever is longer. Record keeping is also required if you are temporarily removed from your job under the Medical Removal Protection Program. This record must include your name, the date of your removal and return, how the removal was or is being accomplished, and whether or not the reason for the removal was an elevated blood lead level. Your employer is required to keep each medical removal record only for as long as the duration of an employee's employment. The standard requires that if you request to see or copy environmental monitoring, blood lead level monitoring, or medical removal records, they must be made available to you or to a representative that you authorize. Your union also has access to these records. Medical records other than PBBs must also be provided upon request to you, to your physician, or to any other person whom you may specifically designate. Your union does not have access to your personal medical records unless you authorize their access. 13. Observations of monitoring. Paragraph O. When air monitoring for lead is performed at your workplace as required by this standard, your employer must allow you or someone you designate to act as an observer of the monitoring. Observers are entitled to an explanation of the measurement procedure and to record the results obtained. Since results will not normally be available at the time of the monitoring, observers are entitled to record or receive the results of the monitoring when returned by the laboratory. Your employer is required to provide the observer with any personal protective devices required to be worn by employees working in the area that is being monitored. The employer must require the observer to wear all such equipment and to comply with all other applicable safety and health procedures. 14. For additional information. Copies of the standard and explanatory material may be obtained by writing or calling the OSHA Docket Office, U.S. Department of Labor, Room N 2634, 200, Constitution Avenue, N.W., Washington, D.C. 20210. Telephone, 202-219-7894. 1. The Standard and Summary of the Statement of Reasons, Preamble, Federal Register, Volume 43, pages 52,952 to 53,014, November 14, 1978. 2. The Full Statement of Reasons, Preamble, Federal Register, Volume 43, pages 54,354 to 54,509, November 21, 1978. 3. Partial Administrative Stay and Corrections to the Standard, 44 FR 5446 to 5448, January 26, 1979. 4. Notice of the Partial Judicial Stay, 44 FR 14554, 14555, March 13, 1979. 5. Corrections to the Preamble, Federal Register, Volume 44, pages 20,680 to 20,681, April 6, 1979. 6. Additional correction to the Preamble concerning the construction industry, Federal Register, Volume 44, p. 50338, August 28, 1979. 7. Appendices to the Standard, Appendices A, B, C, Federal Register, Volume 44, pages 60,980 to 60,995, October 23, 1979. 8. Corrections to Appendices, Federal Register, Volume 44, 68828, November 30, 1979. 9. Revision to the Standard and an additional Appendix, Appendix D, Federal Register, Volume 47, pages 51,117 to 51,119, November 12, 1982. 10. Notice of Reopening of Lead Rulemaking for 9 Remand Industry Sectors, Federal Register, Volume 53, pages 11511, 11513, April 7, 1988. 11. Statement of Reasons, Federal Register, Volume 54, pages 29,142 to 29,275, July 11, 1989. 12 is Statement of Reasons, Federal Register, Volume 55, pages 3146 to 3167, January 30, 1990. 13. Correction to Appendix B, Federal Register, Volume 55, pages 4998 to 4999, February 13, 1991. 14. Correction to Appendices, Federal Register, Volume 56, p. 24686, May 31, 1991. B. Additional information about the standard, its enforcement, and your employer's compliance can be obtained from the nearest OSHA area office listed in your telephone directory under United States Government/Department of Labor.